Sam, do you think there's such a thing as a good death?
I do think there can be. Yeah, I do think the reality of the situation is death can happen on an entire spectrum of positive and negative experiences for the patient and whoever's directly observing it happen. On the really negative end of the spectrum, some folks unfortunately go through a great deal of agitation or confusion or restlessness, where they're in the last hours to days of life, maybe they're pulling at their clothes or tubing or trying to get out of bed. Maybe they've had a couple falls. That would be kind of on the bad side, and alongside that, maybe their pain isn't quite well controlled enough, either because they just have a disease process that's quite painful, or maybe we haven't been medicating them as often as they should have been medicated. On the other end of the spectrum, you would have people that appear very peaceful. They don't require many medications. They don't really get agitated or anxious, and they basically just sleep and drift off and pass away. So I think those would be kind of the two ends of the spectrum, and then of course anything and everything in between. But yeah, if we're doing our job to the best of our capabilities, and if patients, friends, and families or advocates are hearing our advice and doing everything that they can and should be doing, I'm very confident that hospice can provide a very good death for the majority of our patients.